You're watching this video because a surgeon has recommended you have excision of an intradural spinal tumor. After being put to sleep, you'll be placed face down on a special soft mattress. An incision or cut is made in the skin of your neck. The length and location varies depending on your personal requirements. The muscles and tissues are parted to reveal the bones of the spine. A small opening is made in the bone to reach the spinal cord and nerves. This may be done at one or more levels in the spine. Various tools can be used to achieve this. This part of the vertebra does not have any structural importance and does not usually need to be replaced or fixed afterwards. The surgeon will then open the sac containing the spinal cord and nerves. The spinal fluid is released and the abnormality identified. Here, we show an example of a tumor compressing the spinal cord from the side, but it can vary in size, location, and how stuck it is to the spinal cord. Examining it under an operating microscope, the surgeon will take all of these factors into account to make a plan to remove it as safely as possible. A range of different instruments can be used to remove it, while minimizing movement of the spinal cord. The surgeon will remove as much of it as possible. However, if it is particularly stuck to vital structures, some tumor may need to be purposefully left behind. Even if all is removed, there is a small chance that a few microscopic cells are left behind, which may regrow in the future. Occasionally, if it is growing from a spinal nerve and cannot be separated, the nerve will be cut in order to remove the tumor. If the nerve had any function, you may lose this permanently. When satisfied that as much tumor as safe has been removed, the surgeon will perform a watertight closure of the sac to keep the spinal fluid within it. This may involve sutures, clips, glue, or patches. The muscles and skin are then closed with sutures or skin staples. The spinal cord and nerves will then have a chance to recover. Any symptoms may improve quickly, but it might take weeks, months, or even years for your symptoms to improve. Some symptoms of spinal damage may not get better at all.
Out of every 100 patients, between 1 and 5 suffer from a minor or treatable complication from spinal surgery. These risks or complications may include wound infection. This is when bugs get into the wound and affect the healing. You may need antibiotics to treat it. Rarely, an operation is required if the antibiotics don't work. Bleeding or bruising, which usually resolves on its own over a few weeks. Rarely, if the bleeding does not stop on its own, you may need another operation to fix it. CSF or spinal fluid leak, which requires you to stay in hospital slightly longer to ensure it heals up. Sometimes, a further operation is required to fix this if it doesn't heal on its own. Some suffer an injury to a spinal nerve. If this happens, some patients suffer from increased leg, arm, or back pain. Some may have altered feelings on their skin or even a numb patch. This is often temporary, but it may, unfortunately, be permanent. Some people may form a scar around a spinal nerve. Over time, this can cause pain or discomfort, which may be similar or rarely worse than the pain before surgery. Even with surgery that goes according to plan, your symptoms may continue. In some cases, they may improve and then return again. The purpose of the surgery is to improve pain and mobility, but in some people it doesn't work or doesn't last. Most spinal operations require you to be face down to reach the spine. Parts of your body may feel pressure that they're not used to. This can cause soreness or even abnormal feelings in your body afterwards. This is usually temporary. These may include one of the following: damage to spinal nerves, which can temporarily or even permanently affect your ability to walk, control your bladder, or control your bowels. It could even affect the feeling around your genitals and your sexual function. If this happens, you may require a period of rehabilitation. and may affect your ability to work and live your life fully. There's also a very rare risk of complete paralysis, which is nothing working from the waist down. If a major blood vessel is injured, this can cause injury to the legs. It may require immediate surgery to try and fix this. Most spinal operations require you to be face down to reach the spine. There may be pressure on your face and eyes. Rarely, this can cause injury to the eyes, which can affect your eyesight permanently. Some people cannot tolerate an anesthetic safely. They may have had a bad reaction to the drugs or develop complications from surgery. This may include blood clots in the legs and lungs, or stress on your heart, lungs, and kidneys. If you've had a bad reaction to an anesthetic in the past, please make sure to inform your medical team. If one of these uncommon risks turns into a complication, extra procedures may be required, such as a blood transfusion or further surgery. If any of these serious complications occur and they cannot be treated, there is an extremely small risk of not surviving the procedure at all. Thankfully, for most patients, there'll be no complications. You'll be encouraged to do some walking and gentle exercise, which should build up over the next few weeks and months. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team. Thank you for listening. Please watch this again to ensure you have understood everything.